How does the urethra cause sudden urinary urgency? Have you ever experienced a sudden, overwhelming urge to urinate? This feeling can be quite alarming and is often linked to the urethra's role in bladder function. Sudden urinary urgency primarily arises from increased sensitivity and reflex activity in the urethra and bladder, especially in the area near the prostate. The urethra has stretch receptors that work alongside those in the bladder to signal to the brain when it is time to urinate. When these receptors become overly sensitive or irritated, perhaps due to inflammation or infection, they can trigger a strong need to urinate, even if the bladder is not full. The communication between the urethra and bladder occurs through nerve fibers that detect bladder filling. These signals travel to the spinal cord and then to the brain. Two key types of nerve fibers are involved: delta fibers, which respond to normal bladder tension, and C fibers, which become active in cases of inflammation or irritation. When the C fibers in the lining of the bladder and urethra are activated, they can create abnormal sensations of urgency. In conditions related to prostate health, such as benign prostatic hyperplasia or prostate cancer, the urethra can be compressed or irritated by an enlarged or inflamed prostate gland. This compression can reduce the bladder's capacity and irritate the urethral lining, increasing receptor sensitivity. As a result, involuntary bladder contractions may occur, leading to a strong urge to urinate, even when the bladder is not full. Moreover, inflammation or infection affecting the urethra or the trigone area, which is a triangular region at the base of the bladder, can cause swelling and loss of bladder elasticity. This condition can make even slight stretching of the bladder painful, triggering a sense of urgency. In summary, the urethra plays a significant role in sudden urinary urgency by hosting stretch receptors that can become hypersensitive due to various factors. It is also involved in reflex pathways that cause involuntary bladder muscle contractions, signaling an urgent need to void. Additionally, prostate enlargement or tumors can compress or irritate the urethra, reducing bladder capacity and heightening urgency sensations. It is essential to understand that urinary urgency can have multiple causes. If you experience this symptom, consulting a healthcare professional is crucial to determine the underlying reason and appropriate treatment.